You may proceed. Hello?
Yes, can you hear me?
Yes, we hear you. You may proceed.
Okay, so thank you very much for giving this chance to Mofate team, and actually I'm very glad to hear everyone in the board, but I'm very thankful for this chance. So we'll have a few minutes of presentations from Mofate, and I am Moses Evaristo, President of Mobile Facilitation Team. I will be taking you through these presentations. So we have two portions to present and to share with you this time around. So we have the first portions, Mofate profile, and the final portions will be regarding the career or nursing in general. So starting with the Mofate profile. So actually mobile facilitation team, because it is the first time for you to hear, this is a non-profitable organizations, and these have been pioneered by nurses in Tanzania. So officially, this Mofate has been registered under the Non-Government Organizational Act 2002 with the registration number of 5314, as you can see from the board. So organizations operates with the missions to foster talents, creativity, and innovative ideas aimed at enhancing healthcare delivery and professional development for healthcare workers across Tanzania. So this is the great missions that we are doing all the time. So we are turning out the talents, creativity, and innovations. And this all coming from the healthcare professionals, including nurses and the midwives, because are the areas where we are much putting our effort, and also inclusively. So we have a mission and a missions that actually operate the Mofate itself. Okay, should I continue?
Yes, you may.
Okay, so we have a vision and a mission, also values that also driving the Mofate itself, and making this one to be clear for everyone. So our visions to be a leading professional bridge in enhancing health of the client through evidence-based practice and development of health professional in Tanzania. And this is the things that we are doing all the times. We're having the online sessions, or we have a different innovation ventures programs that always brings on the table the evidence-based practice. So our mission, as I've said, that we are here to bring out the talent, creativity, innovative ideas, and an investment of health sectors, professional, enhancing client care, personal development through sharing in various areas. So we have thematic areas that we are dealing with them. So we'll see it later on the next presentation slides. So core values, we always live professionalism. That is what we are doing all the days while we are learning Mofate, because we engage with the healthcare professionals. So we are always basing on the professionalism. All issues across Mofate that we are doing, actually it's defining the professionalism in general. So also we are very transparent for issues that we are doing, and our engagement with the youth as what we are doing today. So also we are very accountable ourselves for the different matters and different issues that we are doing within Mofate and also across the profession in general. But also we are very responsible for some of the issues. Also we are very creative and innovative respect, and also we have a priorities, and most of the priorities is taking out all activities that enhancing the healthcare provision in Tanzania, specifically engaging the youth, the young generations in the digital platforms, so that we come up across having a discussions, having a lot of issues that are professional relating issues. So we expect these are the most priority because of the world changing. So we have some of the objectives that drives the Mofate itself. We stand with only 4 objectives. The first objective, we are shaping the ideas and stimulating the professionals. So if we found the professionals, they are having ideas, they have the innovations, they have a creativity in any way, careers. So we are Mofate shaping because we have something called Mofate Digital Health Artworks. I'm sure that you have seen through the posters, we have seen through the banners that circulating around the place. So we shape so that people around different areas, they can see what we have. So the other objectives, we articulate the evidence-based practice, health-related projects that are supportive in healthcare deliveries from the profession in Tanzania. So this is what we can see ourselves. So if there is an evidence through our lead-related sessions that we are driving through Mofate, where we engage the top-notch seniors, We engage a top-notch expertise and experienced nurses and the other professionals during learning different online sessions. Almost we are discussing the evidence-based practice always that can change or transforms our way of supporting our professionals in a different ways. So also we provide the blending packages, like I've said already, something called digital health artworks. So we design a lot of materials that are visualized. You can see from the posters, you can see from the leaflets, you can see from the animations and all the issues that always visualize the activities that we are doing. So if we have innovations, creativity, we visualize them so that the other people, they can see what we have. And this is what we encourage much our young generations to be with Mofate so that they can visualize their activities through Mofate. So providing professional support and matters of community, this is what we are doing all the times. Like you can see, we have some advocacy activities that we are doing. So we have driven some of the activities that are TANA, Tanzania National Nursing Association's activities, but also we are driving some of the integrated activities from the Ministry of Health. Like now we are taking, heading some of the presentations, including respectively maternity care, but also respectively care and effective communications, plus communication skills and customer care. But also we are doing presentations on labor care guide and also mentorship on that. But also we are doing leadership. So all of the issues that I'm trying to mention here almost is providing the professional support, because the professionals that benefit much on this are nurses, and I'm very happy to see also the young generation, they are now involved in this learning session that we are driving all the days, including leadership and management mentorship that we are doing for university nursing students across the country. So we have some of the thematic areas that we are engaging ourselves most of the time. And the first thematic area is training. So within training, what we are doing is just to capacitate, also providing the skills, development, and professional growth for the different healthcare professionals. So when we see some of the gaps that needs more much capacity building from the training area, that is what we are doing so currently. Including the leadership and management mentorship that we are doing for nursing students across the country like now. But also we have some of the activities, including this in every month we do 2 online sessions. Those are the training issues that we are doing. And so far other issues that I can't even speak all of them here. So the second thematic area that we are so much engaging with it in the community. So within a community, we are doing some of the outreaches, but also we are creating awareness to some of the issues, including visualize the issues relating to nursing. So this is the things that we are doing all the time. So almost even we are doing some of the health promotions activities. Like if we find the nurses who having creativity or having some of the projects, so we visualize them so that the community can understand. Also, we teach or we extract those ideas from the board, from the written documents, from the articles, from anywhere, and we put into visualization material through blending, and then we send them to the community. So we see like the community is now engaging with knowing some of the issues that are updated from the Mofate. So the other thematic areas we have is clinical. So within clinical, we are doing evidence-based practice, quality care, and hands-on service improvement through the leading sessions that we are doing all the times as Mofate through digital learning platforms that we are doing all the times. So we have some core functions of Mofate that almost we want also the young generations today that are reasoning us to pay much attention on this. So as Mofate, we provide the chance of talent development. So within this, as I've said, that we have some of the projects that are Innovation Ventures program. So we did it for some nurses. We have identified them and we are still blending them on their ideas. So also the other function, we innovations facilitation. So if we find that the healthcare professionals, including nurses, including you young generations, you have innovations, then we provide our airtime, we provide our platforms, specifically this Google Meet, and then we invite top-notch seniors. Then they can listen from you. You present your idea, and we visualize your idea. We plan your idea so that finally you can reach up the place you want to do. You want to go, and people, they will know what you have. So this is one of the core functions that we are doing. But also professional development. That's what we are doing. We are providing CPD points for those who are having to renew license and other issues, and also to continue having a personal growth through mentorship that we are doing all the time. So you can see from the webinars that we are conducting all of the days, and we are sharing through the posters, and I think you saw them. Also, we have digital health artworks, like what I said here. So within digital artworks, we have 3 areas. We have one, hosting, and we have designing, and also we have the marketing, because we are crossing all over the social networks. So also you have a network. So if you have activities, we make it in artworks, and then people, they can hear, they can see, they can even engage, they can follow you, because you have something that they can learn from professionals. So also we have the event scheduling, like what you see, like today. Also networking, like what we are doing even currently. We are connecting with you so that you can know some of the benefits and opportunities that you can earn from Mofate. So capacity building, like what we are doing. So if we found even you have an idea, but the idea is not so much shaped. So we are Mofate, we receive that idea and we make it, we magnify it by using a different approaches, like I've said from the previous slides. So we have some of the units. Maybe this one will be benefit for you as the one of the area that you can be more much interested, whether to involve with Mofate or even to find the Mofate opportunities, so that you can show up or you can showcase what you have specifically in terms of innovations, creativity, like what we are trying to say or to speak here. So the first unit that we have is monitoring and evaluation unit. So this is very important, and the next days we are going to have these calls. We are going to drive this training. That is what we call a monitoring and evaluation e-learning program. So we'll start a few days to come. So we know that this monitoring and evaluation actually goes to the different areas where we're going to work. But also the other unit that we have in Mofate is the Information and the Communication Technology, ICT unit. This is very important area where we design website, we monitor website, we do branding and promotions, we do artworks within it. That is the unit that is specifically, and it's having its head of department. So if you have any challenge or you have any issues that you want to share with Mofate that relating to information and communication technology, ICT, then the door is open for you. But almost we have another online conference. This is one of the units. Like you can see, all the days we are doing the digital conferences. We are doing webinars, and we are doing a lot of issues that are monitored in a digital ways. So that is a unit where there is a head of this unit. But also we have online branding artworks. Here we have designing through the advanced techniques or advanced applications like Adobe Illustrator, Adobe Photoshop, and other issues, where we also here having the time to teach and to make someone else to understand on the importance of this one. So we invite also, if you have something else across here, you can even tell us, and you can join us as Mofate to move with together. But also we have research and training unit. We as the Mofate, we believe much on evidence-based practice. So we are Mofate members, we are doing research. This time around, within Mofate, we have a team that even publishing the research, and we have published some of the researches articles. So we also provide the training, and we have the training that will be coming next days with the university nursing students, but also the other staffs. So if you are interested in the research and the training, actually you can even engage with Mofate, and if you have probably short courses to train and to take advantage of that, so we invite you to be with us. And also the last unit that we have is social modulations, because as Mofate also we believe that some of the mental related stress and the mental related issues are happening because some of they miss some of the social interaction. So within Mofate we have this social interaction unit that can make us to go with it. So ongoing projects, we have research training, we have respective maternity and labor care, we have monitoring and evaluations, e-learning program, I have said. So we have respective care, effective communication, customer care, and also we have leadership and management mentorship. And so far we are doing for the nursing students, nursing university students. So membership, how you can be a member of Mofate. We have a local legislation, we have international legislation, and we have NGOs or institutes that can register from the Mofate and the benefit as I have been analyzed here as part of benefits. And downward, you can find the membership registration link. So as you get it, you can register. Professional business forum we have is what we call Mofate Academy. So within Mofate Academy, we have created this platform so that you can buy and sell materials here. So what you can sell, you can upload, and people, they can buy them, as what we do in Kiku, like what we can do in Alibaba. So also in Mofate, we have something called the Mofate Academy. So you can sell your books if you have. You can even buy the books if you want. Articles, if you have, you can sell it. So short courses, you can drive through Mofate Academy. People, they buy it online and they can join with their lives. But also you can register there as student or instructor. So the link also is there. A contact you can see from there, or almost Mofate funds from all the social networks by using official Mofate as the name. You can find us there. But the mostly official forum that we discuss a lot of issues there, and you can even engage and know a lot of issues that are concerning with the Mofate, is www.mofate.com as a website. So finally, let us present something called a new definitions from ICN, and I think this is a professional career talk that we prepared for you. So you know that currently we have a new definitions released by the ICN. Thank you very much. So this definition is very important for us to take as a part of a modernizations movement that ICN wants UNESS to go. So I want to know just to discuss with you the definitions, and sometimes to ask you how are you perceiving from the definitions. So the new definition saying is nursing is a scientifically grounded, person-centered led profession that promotes health, prevents illness, provides care across the lifespan, advocates for individuals and the communities, lead within the healthcare system and policy to achieve health equity. So this is very important because this definition now makes us nurses to proud of our professionals. So how we can know that we have to make change from the ordinary one, and they now focus how we can define nurses in the different coverage. So all the focus, primary caregiving, clinical care, patient-based, implicit equity. You can see all the focus was just focused on one area only. But this time around, there is some advancement we can see from the definitions, like involvement ourselves in leadership. We have to take care on that. Advocates, how advocacy is now defining the nursing, education and digital innovations. Whole system approach means that we can now modernize our nursing by involving in the different areas, including the system itself, where this is the area we were missing all the times. Community and system-wide population health impact, direct emphasis on health equity. This is very important approaches that have been added. So this time around, we can emphasize that you as a nurse now, you can be motivated yourself that you are now, the definitions covered the scientific professional approach, also covered the issue of advocates and educators, but also covers the global health leaders, where now this strengthens the identity of nursing and empowers the profession to shape the healthier feel in the world as part of nursing. Then this one I think is very important for us to go. Because of time, I can just end up here because you said I have 2 minutes to go. But I want to say only one thing for you, that nursing now is a profession centered on light, equity, system, culture, and science, and ethics. Also, take a note that a nurse is an educated, regulated, autonomous professional performing roles from direct care to system leadership and the policy reform. These are the final take that you have to take as you are going to graduate today and you are going in the street. You have to understand you as a nurse now, you have to stand with the police, you have to stand with the system, you have to stand with performing a direct care. So if we meet with the other professionals, then we are going to engage ourselves to define the clear about the nursing profession. Thank you very much. And tusijichukulie poa, we are now leading the world. So lazima to stand for our profession. Thank you very much for the chance. And welcome to Mofat.